Over 300 persons have benefited from the Arise Care Ministry Community Health Outreach at Ihe Community in Ogu local government area in Enugu State. The non-governmental organization specializes in general outpatient services, health education and promotion, child care and education, home care services, and care for the elderly. In his address, the medical director of the organization and Southeast Secretary, Nigerian Medical Association, Dr. Sonny Okafor, stated that healthcare covers free checks, drugs, surgery, and even referrals of cases beyond their capacity.
This division was actually founded by our own Mrs. Uche Okeke, the woman who thought it wise that the health of the communities, the health of not just the town, but that of the entire community in Ogun is actually protected. You look at the patients that are actually here, they cut across from both here and beyond. Those of them that are coming here come with all range of diseases. And we are providing general outpatient services. We are providing health education and promotion, which we just finished. That is the section we just finished. Then we are also providing rehabilitative services for the elderly. There are so many old people's homes that we are running in this town. So our staffs are actually going there to provide home care for all of them. And we're also providing medical care. It's a whole range of programs for them. Then we have our school health programs. Part of it is actually, you look at the children here, we started a periodic school health program. A lot of them with all manner of illnesses, ranging from oral health, eye care, skin infections, including ringworms. So we commenced the program for them. And from the report we're actually having, they are actually responding to treatment, all of them. So what you're actually seeing here, just like I said, is our community health services, which we do every other week here in this base. And it covers a whole range, including referral services. Every patient that actually has, we feel that will benefit from the services that we provided at the tertiary care, like UNTH and Esu Parkland. We do referral here and we follow them up. We call the consultant and professors and others, and we follow them up here because they are also our members. I'm using also my reach as the General Secretary of the entire doctors in the state and Southeast to be able to help our people.
Dr. Okafor noted that sustaining the project has been a tough task and appealed to relevant stakeholders and well-meaning individuals to partner with the ministry in order to expand the program of other local government areas of the state.
Well, I must say, sustaining this kind of a project is quite a Herculean one. It's a humongous project. Thanks to the sustenance, the provision of the founder. In fact, sometimes we've actually tried to think around how we can actually get sponsors, partners, to be able to actually help in the project. Because this is not really a project that one person can actually carry all on herself. So part of the things we are trying to do is to see how we can reach from within and without, potential donors and partners who would be able to actually have a buy-in in what we are doing. Health is universal. We can actually access grants, we can access donations, we can access a whole range of things, not just monetarily. We can actually even have supplies. Drug companies can actually come in to help us to do some supplies of medications, some solutions. In fact, we are actually triaging even patients for surgeries because we want to, by the time we actually finish the permanent sites, we are going to actually move to the permanent site where we're actually going to be running surgical programs for them. So we will need a lot of support so that what the founder is actually doing and what some of us, the resource persons, are actually helping her to do, that we'll be able to ensure that the services are sustained, not just for the good of the communities in Ogu and beyond. Because I've been interacting with her at our top level management. We are looking at how we can actually network around the entire 17 local governments in Enugu State to see how we can actually make such services available in these areas. So we need really a lot of interventions from partners, donors, both within the country and outside the country. And that's exactly what we are working on. And calling on well-meaning individuals to actually come in and help us. Because you can see, the economy is so bad, the people are suffering, hunger is everywhere. So if there's anything we can do to help them, we can do to help them. That's exactly what we're actually doing here, and we're calling on them to help us.
Speaking on the occasion, the State Secretary, PDP Enugu, Chief Cletus Akalosi, commended Mrs. Uche Okeke for the initiative and urged other notable sons and daughters from the area to follow in the footsteps.
You know, what is happening here today is something you rarely see around our climb, because it's hardly for you to see an individual embarking on this kind of project. You know, we always believe that this kind of a thing is supposed to be handled and done by the government. But the way you see an individual discomforting herself, bringing up her personal funds to come up with this kind of program is highly commendable. So I'm glad to be here today. I'm glad to see that a lot of people has already gotten their medical care. From the list I saw, them of different ages. And you know, we said that health is wealth. So I'm very happy to be here, and I also thank God for what is happening here. I also want to encourage the Mrs. Okeke that has deemed it very fit to embark on this kind of project. I'm believing that God is the only person that can pay her back.
Chief Ralph Onovo, who described the outreach as an act of selflessness and service to God, expressed happiness about the testimonies from the outreach.
One of our wives, when their brother marry a good wife, it's now our wife. Everybody will claim, because in Igbo land, one person don't marry, especially when you get the virtuous wife like Mrs. Uche Okeke, that is have this initiative of this program. Mrs. Uche Okeke, it's not really in Nigeria. It's origins of America. We keep monitoring the health status of his parents, aged parents within this community and beyond. It's not only here. Some from other towns do come. Who are privileged with this information. Before I came here, over 100 people have been tested, diagnosed, treated, and have left. That's over 200 are still here, and they are still coming. Last year she did it. Last 2 years she did it.
The outreach, which was duly conducted, followed documentation of patients' BP checks and health awareness talks on basic hygiene practices.
Ahomado bugas, and that gas are very acidic, and all the cause also. Now, I've told you people, I could go maybe say that na was ahomado balance. Balance. Once you have a balance or gene, oh yeah. Una na not now. All got how is word. Oh yeah, didn't I one now? Oh, you knew body over anything. The ear cause imbalance.
Some of the beneficiaries who spoke to Ogama TV expressed their happiness over the gesture. 81-year-old Mr. Ude Clement said that the drugs and treatment received has significantly improved his health and condition and made him look younger. Another beneficiary, Mrs. Mary Rose Obako, who rained prayers on the organizers, said that the process was seamless and treatment is free of charge.
Since we got there, I wouldn't have Naya BP, Naya us, Naya Hanabo arthritis. So I wouldn't have a young by on a alumna. So my sugar, and you had a more weba, Nata Gade Philly. So I won't overhold over Hana Mama Naga like this. You know what a man when I'm kind of look young. It's 1 year. Now you're not in it. Cordon water with a hospital. Nama. Then as you know that he had a him above and hatching a lake. I would tell her. Find out what her. A year, a your one, a your mother. I'm off. Robert Hatchie lake, more worker, got quite higher. Oh, I can no bag of volunteer. I can no job on any name what he had a corner born hour. And that come now. My questa, at school again, no come to never results.
Nkenelu Chineke n'ọnwa m dị ewutere ihe anwaja. Nkenelu Chukwu chebe ochi n'aka Chineke sukwele ji osele nawa. Ọ na-agba nnukwu ike ya. M na-ahụkwa ife ya. M na-ekelekwa Chukwu. Na omekwa bụ ọgwụ a na-enyere ihe ma nwụhụ. Mmadụ anaghị m ego na kaadị m ihe ọbụla. Mmadụ anaghị m ihe ọbụla ka. Jọs ha na-etegbuo m gbagbuo m ihe n'aka tugbuo m nke a na-atụ n'aka. Nke ihe ha hụrụ m ga-enye m ọgwụ mgbe m kọwagbuola ha ka o jido ndị. Ekpere m na-ekpe n'isi ebu uche Chukwu na jee ya ebe ha echi n'aka Chineke duru ha ga-eduru ha nawa ihe ekwena ihe ọma ọ kwadole n'ụwa anwa na ọ na-eme ezigbo ihe a na-abịa eke n'ụlọ ọgwụ a na-anaghị ụkọba a na-anaghị afọ ekpụrụ ọgwụ kpa ewu ọ na-agbanụ Chineke goziere m n'aha Jizọs.
The outreach, which is sponsored by the founder, Arise Care Ministry Chief Mrs. Uchenna Okeke, has impacted many with wonderful testimonies from beneficiaries and commendation for her goodwill and selfless service to humanity.
The medical outreach is one of the programs that Arise Care Ministry is handling. We also have the school section. All right. So the outreach is meant for all the people here in Ihe and environs. Every person that has the need or the services of a medical doctor is here. No discrimination. And then the organizers of this particular ministry have been trying, providing Medicare's free. Medical doctors are here, nurses are here, and then we have caregivers as well. So they are taking care. There are even, apart from those that can come physically, there are people that are challenged, that are at home, that can't come. The caregivers go to their houses one after the other and take care of them, washing their wares, giving them medication, and then giving them food as well. The ministry prepares food for all the participants.
Arise Care is an organization that was set up to cater for the health of the people, and everything done here is free of charge to the community. So it's a wonderful project that the founder of this Arise Care, Mrs. Uche Okeke, she came up with this vision, and it has been a wonderful experience because, you know, when you are able to better the lives of people and give to the people, give back to the community, it's such a rewarding experience.
Arise Care Ministry was established by our sister who had the vision of God. In fact, God has given her the vision to take care of the less privileged ones and to make sure that every one of them are in good health in terms of the health center. The health center. So she kind of following the vision God had given to her. So she decided to come down to the village here where we are and establish this ministry to the favorite of the less privileged ones. So, and that is what we are doing. As you can see today, this is one of the outreach that is on now, the outpatient service. So we are into it, and by the special grace of God, everything by the help of God is going well.
The projects, which commenced since 2019, have benefited over 4,000 people across our local government area.